Hello, my name is Kimberly, and I am the Caregiver Education Coordinator at the Alzheimer Society. The Alzheimer Society knows that caring for someone living with dementia can be challenging. We know that this is even more challenging with social distancing as we try to prevent the spread of COVID-19. This video series will help care partners of people living with dementia to keep themselves and the person they are supporting safe and engaged during social isolation. Perhaps you are still working, caring for a family, and having to offer support to someone living with dementia. You may have increased financial costs as many caregivers have been forced to leave work to protect the well-being of the person they are caring for. We understand that your situation may not be easy, and we hope that some of the suggestions and activities in this video, along with others in this series, will support you. In this video series, we will explore tips and safety measures during COVID-19, ways to keep the person living with dementia engaged with meaningful activities, supportive communication, and how to take care of yourself and some of the available supports. Please be sure to watch each video in this series to best support yourself and the person living with dementia that you are caring for. In this video, we will focus on ways to make communication with the person living with dementia as effective as possible, despite some of the changes in communication that they may be experiencing. This is especially important during this time when you may be spending more time together or only speaking at a distance. We will talk about some of the changes in communication that the person living with dementia you are supporting may be experiencing, and things you can do to improve communication, as well as things to avoid. Dementia affects different parts of the brain and affects the way that they function. This leads to changes in how the person communicates. Some changes include difficulty understanding what others are saying or following conversations. The person may have trouble understanding the meaning of words or remembering what was said. There may be some difficulty expressing themselves. Changes in the brain can make it hard for the person you are supporting to remember the words that they want to say or to be able to put words together in a meaningful way. This may lead to the person saying the wrong word or struggling to say the word that they want. They may also have trouble coordinating muscle movements to say words or even revert to their first language. They may become frustrated or agitated when trying to communicate. Having these difficulties with understanding others and being able to express themselves may be very upsetting for the person. This can lead to the person becoming agitated. For example, you may notice that they are yelling or making sounds. Expressing anger towards others around them or with themselves is also a result of becoming frustrated when trying to communicate. Some important things you can do to support communication with the person living with dementia in your life are to make genuine eye contact if it's not upsetting or disrespectful for that person. Minimize or get rid of distractions and noise. Use touch if it is appropriate to help reassure or guide the person, ensuring that you are engaging in proper hand hygiene due to COVID-19 precautions. Use body language to help show your meaning or to demonstrate what you want the person to do. For example, use hand gestures to show the action of drinking a cup. Communicate through their senses: touch, sound, sight, smell, and taste. Watch the Activities to Support People Living with Dementia video in this series for some ideas to connect through senses or reminiscing. And respond to the person's emotions rather than their words if you don't understand what they are trying to say. There are also some things you should avoid in order to communicate effectively with the person in your life with dementia. You want to limit open-ended questions, which can be harder to answer. For example, Instead of asking, "What do you want to eat?" try giving two choices, such as, "Would you like pasta or rice to eat?" Limit the use of negatives. For example, instead of saying, "Don't sit on that chair," try saying, "Come, have a seat over here." Do not quiz the person, which may be upsetting when they can't remember. For example, instead of saying, "What's my name?" remind them of who you are by saying, "Hi Dad, it's me, Sarah." Don't talk as if the person is not there. Even if you think the person may not understand what you are saying, it's important to stay respectful and speak to the person, not about them. If you need to speak to another care partner or a healthcare provider, step away to speak in private. Avoid arguing or reasoning. The person may not be able to understand your explanation, or they may feel that you are trying to trick them. It is better to try to reassure the person and show them that you are on their side. Don't take it personally. The person is saying and acting the way they are because of changes in the brain that are not their fault. Try to avoid conflicting verbal and nonverbal messages. Try to make sure that your words match your facial expressions, tone of voice, and body language. When these don't match, it can be confusing for the person, and they are likely to rely on nonverbal messages. Here are some resources that were used in preparation for this video. The Alzheimer's Society is here to support you during this time. Contact your local society for more information and services. And don't forget to watch the other videos in this series to support you and the person living with dementia in your life.